Hello, my name's Jeff Dover, and today, fortunately, we have Dr. Weisinger with us, and he is going to explain to us today some of the different types of brain injuries that can occur as a result of an auto or truck accident. Doctor?
Well, brain injuries, especially enclosed head injuries, where there's no obvious trauma to the outside of the skull that you can see, really depend on what part of the brain is injured, because the brain has various functions that are divided over its exterior. As a consequence, you have a number of symptoms that are rather typical. One is headache. That's quite understandable for someone who's been hit in the head. If one seems to be confused or dizzy, it usually suggests there's an injury to the front of the brain. If they are having visual problems and their pupils are irregular, it suggests they've had injury to the back. And if they have had problems with hearing, it suggests they've had problems with injury to the sides of the back of the brain. So the symptoms themselves sometimes will give you a clue. Almost all closed head injuries will result in nausea, difficulty seeing, headache, and confusion, at least for some period of time.
Now, we've had many clients in the past who have had brain injuries or closed head injuries, and they've gone and had an MRI taken or a CT scan, and they've come back normal. Does that mean they have or have not had a brain injury?
Well, actually, the absence of an abnormality on a CT scan or an MRI certainly doesn't rule out that a brain injury has occurred. And that is because sometimes the injury can be very, very subtle. You can have very small blood vessels that have ruptured and can cause very, very small areas of injury to the brain in an area that's very critical to life and to function. So what we tend to recommend is that people sustain head injuries, get a CT scan early, an MRI within a couple days, and then if that MRI is not diagnostic, to have that MRI, tell your doctor you want another MRI within a couple weeks.
Thank you, doctor. If you've had any type of brain or head injury, please feel free to contact us at 770-518-1133.